So they're now saying that social isolation is just about as bad as smoking when it comes to risk of dying of cardiovascular disease. Hi, this is Dr. Casebolt with Forum Health Greenville, and today we're going to talk about cardiovascular risk factors. Why is this a hot topic? Because it is the #1 cause of death in virtually every developed nation, including here in the US. So when it comes to risk factors, we have the non-modifiable ones. These include age. We can't turn the clock backwards. It includes gender. We have our hormones from our gender, and of course, family history. We can't go back and re-choose our parents. Those are non-modifiable. There are many modifiable risk factors, however. Obviously, avoiding bad habits like smoking and drinking. Also, exercise. Now, what's interesting is a lot of the modifiable habits that can decrease cardiovascular risk factors also decrease risk of dementia, and that diagnosis is just as dreaded as cardiovascular. So, exercise of just about any type. Dietary habits, we obviously know we are what we eat, and so what we put on our plate is very important. The ability to manage stress, and alongside that, whether or not you're socially isolated, and weight management. So these are things that we can modify. Included in this is a little subset which I'll call metabolic syndrome. So metabolic syndrome is comprised of basically 4 components. And if you have 3 out of the 4, you are said to have metabolic syndrome. If you have metabolic syndrome, you do have a much higher risk of having heart disease. So that is central obesity, where your waist circumference is too big, blood sugar dysregulation, hypertension, and hyperlipidemia.
Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.